Thank you, Dr. Barry Taylor, for your kind words of introduction. Barry and I have known each other for more than 30 years, and it's a privilege to be invited to speak at this conference, Making Transformation Real in Your Life. At any given moment, each of us is a heartbeat away from being diagnosed with cancer. Not me, I thought. I'm an oncologist, and surely I'll be spared. Every year, close to 2 million people in the United States will hear the words, "You have cancer." I have spoken to many thousands of cancer patients over 33 years. I've experienced my own 2 cancers, skin and uterine, and I've walked with my family beside my father during his 3 cancers, bladder, prostate, and ultimately esophageal cancer, which he died from. From the outset of my career, I've had an ongoing fascination with the journey one takes after the diagnosis. I imagined that if anyone told me that I had cancer, that I would keel over on the spot and die of shock. Surprisingly, neither I nor anyone else expires from the shock of being diagnosed. There is a warrior inside all of us that awakens when called upon. We pick ourselves back up, tap into that ferocious will to live, and rise to the challenge with as much grace as we can muster. My mission is to dispel the fear around the word cancer. It's not an automatic death sentence. It's not even necessarily the worst thing that can happen to you, although many believe that it is. No doubt, there's an intense, immediate, visceral reaction when you receive the news. I certainly experienced that personally. In 2005, I was putting on my makeup and I noticed a small spot near my left eye. It looked like a typical basal cell carcinoma. I went to the dermatologist and he removed it. When I received the biopsy report with my name on that paper, I slipped immediately into shock. In fact, my future ceased to exist. My medical assistant said, "Don't worry, Dr. D, we'll get you taken care of tomorrow." Tomorrow, I couldn't imagine surviving the next 5 minutes. The flood of body sensations was horribly uncomfortable. And as it was all unfolding, I heard myself say, "You're an oncologist. You know this isn't going to kill you." My husband asked me why my knowledge didn't comfort me. My sister asked me if I would have had a stronger reaction if I had been told I had to have a breast removed. I don't think so. It took me weeks to figure out what was bothering me. With my name on that paper, I now had proof that my body knew how to make cancer cells. And the more important underlying question was, what else is it doing that I don't know about? Watching all of those patients throughout my career did not prepare me for my own reaction. And yes, I thank the universe for sending me this experience because I discovered firsthand that we are reacting immediately to the word, equating it with a death sentence. So this is the greatest task at hand and the reason for the book I'm in the middle of writing. Please let us transform our reaction to the word cancer. In the minute before the diagnosis, I was fine. In the next minute, my future collapsed and my adrenal glands responded with a surge of adrenaline that left me shaking. What damage did I do to my poor little body over the weeks of upset from the thought that I might die? The flood of cytokines and hormones that swept through my system wreaked immeasurable havoc. It might sound insane to you, but it actually took me 6 weeks to settle down. But I didn't know it then. It was a blessing in disguise, because 5 years later, I had a single drop of vaginal bleeding. And for a postmenopausal woman, that must be checked out immediately. I was diagnosed with uterine cancer, and I was bewildered that I was marching down the path again, but this time I didn't envision dying. It was a detour to take to get back on track with my health, and I handled it much more gracefully. I had surgery to achieve remission and am considered cured. And as you can see, I'm entirely well. Here's where we have enormous opportunity for taking the challenge of diagnosis with cancer threatening your very existence and transforming it to a moment where you step through a door on a new path filled with challenges, blessings, and hard-earned wisdom. We need a new dialogue about this whole experience so that death isn't the first thing we think of. With the burgeoning technology, I think that we've lost sight of the basics, that each of us was born with: the mind, free will, the breath, intuition, creativity, and a spirit that refuses to be vanquished. The body's wired to heal. It's called homeostasis. When it's out of balance, it's capable of moving back into balance, except that our thoughts, our fears, and our assumptions can sabotage our capacity to heal. With a health crisis, we tend to think of the body as the most important aspect to care for. But without balancing the other aspects, mind, emotion, spirit, we're pouring treatments into a structure with a rotten foundation. I believe that what we say about our experience with cancer, to self and to others, will influence the outcome. Our body's physiologic processes are carried out without our brain being consciously aware. But our conversations, our chatter, can also send a message to the body, both positive and negative. In order for the body to heal, all aspects must be worked on. Everyone wants to be cured, but that takes time, and not everyone will achieve that. If you work solely on the body, therapies have less chance of working if the other aspects are in turmoil. Besides, cure takes years before we reveal that to you. But healing can occur in any moment and can be worked on even when lying in bed, weakened from the effects of the cancer or from the effects of the treatment. The experience of cancer can reveal many, many insights that can lead to a growth and a blossoming in life and in well-being that was unimaginable. Some patients have even said to me that having cancer was one of the best things that ever happened to them. The time they said it, I thought, oh, I don't know. But we're at an unprecedented moment in the history of cancer therapy. There's a whole new approach. It's here now, and it boosts the immune system around the tumor rather than targeting the cancer cells itself. So we're in very hopeful times, and whatever anyone has told you about what's to turn out, it can change. When I first became an oncologist in the 1980s, there were really few treatments to work on that were effective. So I had discussions about other things that were happening in that person's life, and it was a great time for a curious soul like me to discover what people did with that word cancer and with the subsequent journey. Because remember, I thought keel over and die on the spot. I asked everyone what they were doing and thinking. One day a patient asked me, "Is it possible to live in balance with cancer?" I said yes, emphatically. "How do you know that?" he asked. "Well, most men over the age of 65 have cancer in the prostate gland, but only 1 of 10 of them will be diagnosed in their lifetime with active prostate cancer. The others don't know they have cancer. They live with the freedom of not being under the shadow of that word, and they die, never realizing they were living in balance with cancer." So I told that man, if you could rein in your fear and get on with living, we might see something extraordinary. He went on to do just that. And then I told others that he did that, and then some of them could do that. With no effective therapy, patients were able to live for extended periods of time, seemingly in balance with a disease that should have led to a rapid demise. Did my suggestion make a difference? Let me tell you some stories about individual patients. I want to open up your thinking about this journey and about what's possible. This will also give you a little taste of what my book is about. You can decide for yourself what makes a difference in outcome. I strongly believe that what you say makes all the difference. How you view your circumstances can either lift you up or dash you to the mat. Through my medical school years, believe it or not, I had been planning to go into the field of obstetrics. What could be more rewarding than delivering a baby, right? Well, an encounter with a patient in the first few days of my internship revealed an entirely different path for me. His name was Ed. He was 68 years old, a longtime smoker, and he was in the hospital with a lung mass. That day in July 1979, a long time ago, the doctor supervising me handed me his chart and said, "Ed's results are back. Go tell him he has cancer." She walked away. She walked away. I stood there staring at her back as she scurried up the hall to take care of something she thought was more important. What could be more important than this, I thought? Oh my gosh. Nothing that I had learned in my training in the lecture halls of medical school prepared me for that moment. I realized she wasn't going to show me how to do this. And I thought that's what teaching younger doctors was all about. I walked into Ed's room. I sat down next to him, took his hand, and took a deep breath. I didn't want to just blurt out that the lung biopsy results were back. So I walked him through the events leading up to the hospitalization and up to that moment where we were now. As I was gently probing, he bluntly asked me, "Is it cancer?" I nodded, and we sat there side by side, shoulder to shoulder, still holding hands. He asked me if he was going to die soon. Supremely uncomfortable, I told him the truth. I said, "I don't know how long you'll live. Only God knows that, but I want you to promise me that no matter what anyone tells you about your prognosis, you're going to dig down and muster up as much fight as you can and keep going." With tears streaming down his face, he said fiercely, "I will. I still have a lot of living to do." I wrapped him in a hug, and that was actually the first of many that I've given in my career. And with tears streaming down my own face, I said, "Keep living as fully as you can until you take your last breath. That way, you'll have done the very best you can with what you've been handed." I came back a few hours later to check on Ed, and I heard him speaking to his wife on the phone. "My doctor believes that I can do this," he said, with hope in his voice. "She'll get me an expert, but she said that it's up to me to fight as hard as I can." Wow. I learned many things that day. Ed didn't keel over and die of shock on the spot as I had imagined. Although he was devastated, he was still functioning, and my words and my calm, compassionate presence had somehow already started the healing process. Maintaining steady eye contact despite my own discomfort and patiently waiting gave him the opening to ask the difficult questions. Even in the face of terrible news, fostering hope is not only possible, but it has my highest priority. Without hope, the spirit crashes and there is no journey. I found that I had the courage to stay the course through whatever emotional reaction occurred, allowing it to dissipate some so that Ed could move on. Most of all, I learned that the connection between us had enormous power and brought comfort to both of us. In that single interaction, I became a healer. What I didn't realize that day was that the time spent with Ed was going to influence my choice of careers, and that it would begin a lifelong fascination for the journey after diagnosis with cancer. What might be accomplished if we can move past fear and past our preconceived notions of the body's ability to heal? What limitations have we placed on ourselves with that label, or any label? After pondering these issues for years, what I know for sure, to borrow Oprah Winfrey's phrase, is that what one says about the experience with cancer to self and to others will influence the quality of the journey at the very least, and perhaps even the outcome. The next story is about a patient who asked me a question that changed all that I had been taught about the body's capacity to heal. His name is Bill, and at age 25, he was not only one of my youngest patients, but he became one of my greatest teachers. He had been previously diagnosed with testicular cancer and treated. He came to me in a wheelchair because the tumor had recurred and it was compressing his lower spinal cord. As a result, he had weakness of his leg, there was a foot brace in place down around the ankle for his floppy foot, and he was in a diaper, having lost bowel and bladder control. We treated the spine with radiation, and that tumor got better. But one day he came unaccompanied to the visit, and he asked me a question that he had been hesitant to raise in front of his family, his parents and his girlfriend. Is it possible for me to heal the nerves that were damaged by the tumor? What I was taught in my medical training started to formulate in my mind. Sorry, but no, a damaged nerve can't repair itself. But I hesitated, and I replied slowly, I believe that you can heal the nerve. I almost wanted to look over my shoulder to see if my colleagues were watching me. What does a nerve look like, he asked. I glanced out the window, stalling, frantically gathering my thoughts. It was a typical Boston winter day, overcast, cold, damp, blustery. The trees, of course, were bare. So in a moment of inspiration, I asked Bill to roll over to the window in his wheelchair. And we stared out at the trees in the waning light. I pointed out that the nerve exiting the spine looks like that tree trunk coming out of the ground, with progressive branching of the nerve as it moves away from the spine down toward his foot. His nerve was like a tree that had been struck by lightning with the loss of a portion of the branches. To heal it, he needed to visualize the nerve filling in until it resembled a full, beautifully shaped tree. About a year later, he walked in and hopped up on the exam table. Oh my goodness, no wheelchair, brace, or diaper. He reminded me he had been in physical therapy over the last year, but I couldn't fathom that PT would be that effective. And then he added, I've been doing that thing with the nerve. What thing? You know, the tree. You actually did that? I asked with disbelief. Wasn't I supposed to? He countered. Still struggling, I said, but that was a year ago. It took a long time, he said. He went on to describe his daily practice of driving his truck to the end of the street where there was a lake, and he looked out at the trees. He spent 5 to 10 minutes visualizing the nerve in his body healing. And these are his results. So, oh my gosh, I was dumbstruck. First of all, a 25-year-old man took my advice. You know, how often does that happen? But he believed he could heal. He did the work to facilitate healing and had nearly unbelievable results. Again, I ask you, what limits do you put on yourself out of your beliefs in any aspect of your life, not just your health? I believe that we open up the opportunity for ourselves by first saying so, keeping the faith, and then backing the plan up with action to make it so. In other words, we create our lives by speaking the possibility first. Here's an example I give my patients all the time. Picture a young man in the inner city with no economic advantages. Surrounded by drugs and drive-by shootings, he sees that his life is at risk if he stays where he is. I'm getting out of here and I'm taking my family with me. I don't know how, but I will, he says to himself. Keeping his intention firmly in front of him, his path can begin to move in that direction over time, little by little. He takes steps to reach his goal. A social worker doesn't swoop in and rescue him. He exerts his free will and continues to envision his goal until it manifests. He doesn't give up, even though the path looks impossible to achieve. You're probably thinking, but this is cancer we're talking about. So, who is to say which is more difficult? Getting out of the inner city, healing a cancer, or walking after being paralyzed? So I challenge you to think of something new you can say about your life and your health, and begin to back it up with action. What can happen when a patient asks the doctor how long he has to live? Dangerous ground here. I have seen many times patients die on time after a pronouncement. The doctor tells him that he has 3 weeks to live. He repeats that to self and to others over and over again. The body takes its instructions for all of its processes from the brain. Conversation is also being listened to as a set of instructions. The body can wind down all of its processes if you say so. And you can make yourself die on time. Each of our cells has a program that tells that cell when to die. It's called programmed cell death. Well, I call this phenomenon programmed organism death. The physician makes a pronouncement of a time frame. The patient dies within that time frame, and the physician concludes, hey, I'm pretty good at this. programmed organism death. Oh my goodness. My advice, don't ask. Why not? Well, firstly, none of us is a statistic. Secondly, the spirit can't be measured. And thirdly, the next new development in treatment could be right ahead, and that could totally change the prognosis. One of the most powerful motivators to keep living during treatment for cancer and beyond is to set goals. Goals will propel you forward. One patient in particular never stopped with the first goal, and participating in her journey became so memorable for me and my staff. Her name is Terry. She was 46 years old when she was diagnosed with early-stage breast cancer. The cancer recurred in the chest wall area at the mastectomy site at age 49, and she was treated. She came to me for a second opinion a year later at age 50 when it had spread to her bones, and she now had stage 4 disease. So we got to work making a plan. She told me she was a single mom and that her primary goal was to see her daughter, Lynn, graduate from high school. So, as I'm taking notes, I mumbled, "How old is Lynn?" She was only 9 years old, and graduation was 9 years away. No pressure on me. Thankfully, I kept my skepticism to myself. I never, ever would have imagined what unfolded over the years. Terry's disease progressed periodically, and each time therapies were altered. Lynn went on to graduate from high school. New goal set. College, she graduated. She went to pharmacy school and graduated. And then Terry wanted to see her daughter married, and she did. She wanted to witness the birth of her granddaughter after Lynn got pregnant, and she did. I would never have imagined that she would live for 14 years after developing metastatic breast cancer. But she continued to set a new goal, and she envisioned getting there. Her journey was certainly more difficult as the cancer progressed, but she had a smile on her face at every visit as she watched her daughter mature to adulthood, and she shared the wonderful story with all of us. Keeping my opinion to myself allowed her to be in charge of what unfolded. Planning is integral to living a full life. There isn't a time when we aren't thinking about the future. It may sound too simple, but trying to live as fully as possible right now within the physical limits of the body is powerful medicine. When we cease planning, the body receives a strong, unspoken message that we don't expect to be here. Let's talk for a bit about the emotions. Life's difficulties throw emotions out of balance. Even in the good times, we often see our emotions swing from side to side like a pendulum. Why do they shift? Are they even under any kind of control? It certainly is easier to feel positive when we feel well. When in poor health, the moods can rob us of day-to-day quality of life. We know that with all else being equal, patients who experience hopelessness and despair fare far less well than those who experience hope and feel in control of their circumstances. There actually is a biologic basis for this. The white blood cells of our body's immune system carry receptors for endorphins, the feel-good chemicals that our brain makes. So a brain chemical linked to mood can affect the function of the immune system by interacting with the white blood cells. In other words, there's a link between thought and the physiologic processes of the body. We've all experienced how thinking about a stressful event makes the heart rate pick up, the stomach churn. So, with an understanding of thought influencing our biology, wouldn't it be an important practice for the cancer patient to promote positive thoughts and emotions to assist in the healing journey? How do we do that day to day? This is a potential strategy for anyone to use to improve life. It's called storytelling. And the story doesn't even need to be true to be effective. The body isn't judging whether something you say is truth or fiction. It just responds to the spoken words. And so I'll illustrate. Even in dire circumstances, a door can be cracked open to allow hope in. If severely ill with little physical strength, others can help open that opportunity if we allow them to. An opportunity isn't an instant solution. It's a little light on the path that we still have to walk. It's a cart to carry the load. It's as heavy as it ever was, but it seems lighter when it's not on the back. When I met Peter, he was sitting, holding his head in his hands with his elbows resting on his knees. He had visible, profound weight loss. He was clearly ill. He also did not want to talk about what was happening. So his wife, Dee, told me about the recent hospitalization where they had discovered he had lung cancer. A few months previously, he had been entirely well, a vigorous and charismatic man. She said they had no idea how extensive his cancer was, and to make matters worse, the oncologist told him that he had less than a year to live. So I told Peter, I see a man with a very frail body whose mind is teeming with unanswered questions. I see a deep depression and a spirit that has crashed to the floor. At that point, he sat upright, and I moved closer to look him in the eye. I told him that a PET scan would help to answer his questions about the full extent of his cancer. I then said that I would help him to feel the very best that he can under the circumstances. He left with no answers, but he looked hopeful and he was holding his head up. When he returned a few days later, he did his own speaking. I feel better, he said. I have more appetite and I've been eating. His wife even noticed that he was in better spirits and was interacting with her again. Remember, he had no answers yet and no treatment. All he knew was that someone intended to help him. I gave him the scan results, and the cancer was very, very extensive, worse than even I had imagined. He took the news calmly, but his wife, of course, cried. I gave him the choice of making him comfortable with hospice support or proceeding with some chemotherapy to fight the cancer, albeit at a reduced dose due to his frail condition. I fully expected him to say that his spirit was so broken that he had nothing left to fight with. To my surprise, he said, I promised my wife I wouldn't give up. Wow. People have a hard time picking themselves up after a terrible pronouncement. But it's only a piece of information, and it doesn't have to define the rest of one's life. How do we continue on? Try creating a story about where you're heading with your healing journey. Paint a picture of what the future is going to look like and aim toward it. Chase your healing, as one of my patients told me. The funny thing is, even if you don't initially believe what you're saying, it's still important to say it. You may not get to where you want to go, but if you don't speak it and then try to aim toward the desired result, you certainly have no hope of getting there. Remember, the body is listening, and it isn't judging whether or not we believe what we're saying. Creating a positive story about where you're going can lift the mood. Lifting the mood will start to change the physiology of the body. I had been taking care of Diana for years. She was 75 years old and had breast cancer metastatic to the bones. I put her in the hospital to work on things, and there she was with a cast on her left arm from a fracture because the cancer had weakened her bone. We were making progress in controlling her pain, but then her right arm broke as the nurses were turning her in bed. A second cast was placed. When I stopped by to see her, she was in a terrible mood. Both arms in a cast, she was frustrated that she needed assistance with even the most basic things. I swear if she hadn't been in the cast, she would have grabbed me by the front of the jacket to say, I'm depressed and I need an antidepressant. But, she couldn't. I was certainly willing to prescribe it, but I knew it would take weeks to work and that she needed help in the moment. I asked her if she prayed, and she said that she did, that she asked God to cure her cancer. I asked her to try for something a little smaller, more immediate, and perhaps within reach, such as, please help me to lift my mood. Well, she shrugged. It's certainly not usual advice from a physician, and I wasn't at all certain that she would even consider the suggestion. But the next day I was sitting in my office, and I saw Diana blow by my doorway, arms out in front of her with the casts, and a smile on her face. I thought she was depressed, my secretary said. Well, Diana apparently had asked the universe for help with her mood and made such an abrupt turnabout overnight that even I was stunned. It's not a natural tendency to remain hopeful all of the time. The moods are always in a state of flux. If stuck in that glass half-empty feeling, the key is to recognize the down place in the mood or the negative thought and to limit the time spent there. If we want better quality of life, change the thoughts. Negative thoughts can be weeded out and replaced with a more constructive thought. No one else can change how we feel but ourselves. We might need some help with finding something positive to say, but when we happen upon it, repeat that positive thing over and over again until mood shifts. What about the spirit? Although most look at cancer as a crisis of the body, all that I've learned over the years points to the fact that it is first and foremost a journey of the spirit. Even though we're discussing a potentially fatal disease of the body, tending to the spirit will lead the way for the body to heal and sets the foundation for all else to follow. The body houses the spirit, so if the spirit collapses, there will be no journey to worry about. I met Deborah toward the start of my career as an oncologist. She was 38 years old with advanced kidney cancer at a time when we had almost no therapy once it had spread. She was in severe pain, and her husband was weary from delivering around-the-clock care. So we decided to admit her to the wing of our hospital that focused on end-of-life care. She developed kidney failure shortly after admission. She stopped making urine, and she hardly ate or drank anything. The medical facts at that time would have predicted that she only had a couple of weeks to live. She had 4 children, and she wanted to spend as much time as possible with them. Every day, they came to visit after school, and she chatted individually with each child. And she lit up with joy in their presence and then spent a lot of her time resting. As the months passed, we all noticed that we were witnessing a medical impossibility, a miracle, really. There was no scientific explanation as to why she was still alive. She wasn't eating, drinking, or making urine, and yet she lived for 4 months after entering the hospital with kidney failure. She remained bright in spirit and then passed quietly in her sleep, satisfied that her children would be fine. What she taught me is that the spirit drives the journey, not the processes or the functioning of the physical body. And sometimes we physicians are privileged to observe the miracle of someone bringing forth the force of the will, seemingly turning the direction of their path. I became very curious about what affects the spirit, since keeping the spirit intact seems to have much to do with how long someone lives. One of the fastest ways to deplete the spirit is to allow uncontrolled pain to linger in the body. Imagine trying to have a conversation with someone when a fire alarm is sounding in the building. You can strain to hear and be heard, but it would require a lot of work. Pain signals going to the brain are like that fire alarm. The body's immune system has a much harder time tracking down cancer cells and destroying them. Fostering the spirit can be a delicate matter. Treating pain is only one circumstance that can wear down the spirit. Treating cancer continuously over weeks, months, and years can also wear the spirit down. Why not consider taking a break from therapy? Patients are generally shocked when I suggest it, but even if just an extra week between treatments, it can make a difference and allow the spirit to regenerate. The worriers, of course, will decline my suggestion, afraid of cancer progressing, but really, most cancers grow very, very slowly, and a few weeks, and sometimes even months here or there, might not matter. Sometimes not treating the cancer will test the spirit. Oncologists call this approach watchful waiting. But boy, it can be a nightmare to live through, watching yourself without treatment. Bob was a patient of mine for nearly 8 years. He came to me with stage 4 colon cancer that had spread to his liver. And since he had been feeling well, his prior physician hadn't offered any therapy. That was the accepted standard of care at that time. Treat only when the cancer has the upper hand. Bob's cancer was being monitored with a blood test called CEA. So there he is, he and his wife, watching the test slowly rise from 1 month to the next. They were both really uncomfortable with doing nothing. And in fact, they were frantic with worry, and the toll was clearly visible in their faces. Picture this, trying to tell family and friends, nothing is being done. It sounds crazy, doesn't it? They knew that that path clearly and directly would lead to his demise. Family and friends urged him to get a second opinion, and that was me. Admittedly, there were few options at the time for treating his cancer, but I knew that treatment would help Bob's frame of mind and his wife's. So, although physically well, his mental state was a source of suffering. I devised a plan that had just a few side effects so that he could continue a good quality of life. I told Bob that his cancer probably wouldn't shrink significantly with the treatment we were doing, but if the therapy stopped its growth and he could live in balance with the cancer, maybe he would be here for the next new drug. That's exactly what happened. Bob and his wife gradually stopped being afraid of his dying. He lived with a low level of cancer in his system for many years. He was able to move from one therapy to the next as they were developed. In fact, he'd say, "What's next, doc?" when I had to tell him his cancer had progressed. One of them was even in a pill form, and he was able to get free of the pump. There were 7 new drug developments for metastatic colon cancer that Bob was here to receive. He almost became a permanent fixture in our infusion center. He was able to celebrate his 50th wedding anniversary, and he continued to live for several years beyond that. All the while, he remained optimistic that another new drug would come in time for him. Most importantly, the quality of his life was transformed because he was able to relax and enjoy life. None of this would have been possible for Bob if he had not chosen to see a new picture for his future. Yes, I helped him to paint that picture, but he believed it would unfold, and he was here for the new developments. Let's spend a few minutes talking more about the mind and how it functions. We've spoken about how beliefs can either limit or enhance the opportunity for the body to heal. We've discussed how setting goals can propel you into your future. And we see the power of creating a story to lead to more positive emotions, to lift the spirit. The mind is constantly active while awake. There's a background conversation of ideas, memories, worries, hopes, and dreams that flowing along, much like a tape or a movie. The thoughts move in a continuous stream with little awareness of how it actually pulls at our attention. The diagnosis of cancer has a powerful effect on our normal thinking processes. New thoughts crowd in, and the flow of the mind abruptly careens in a new direction. The thoughts no longer drift randomly. There is now a single focus, and that's extremely uncomfortable. It puts you in unfamiliar territory. Even the simplest of decisions becomes difficult, and thinking starts revolving around the cancer situation, day and night. It's important to understand the nature of the mind because part of healing involves tending to it. The mind loves information and will start to settle down as the details of treatment are discussed. The next story is about my patient Henry and how he tried to manage his mind. He was an accomplished research scientist, a protein chemist, whose disciplined thinking processes were instantly disrupted by his diagnosis. I met him several years after he had been dealing with metastatic prostate cancer. He told me that he had listened to the options presented by his prior oncologist, but he felt that he wasn't receiving enough detail. So he spent hours on the internet researching the disease and all of the manifestations in the body, standard therapies, experimental therapies, and then the science behind all of that. The process consumed him. His wife, Esther, said, Henry was actually happy working on this project as if it was one of his university projects. He even found several clinical trials and traveled to other parts of the country to participate in those studies, and he had access to new treatments that were not generally approved. I think that helped extend his life. When I met Henry, I wondered if I would feel intimidated by his brilliant mind. So I steeled myself as I entered the exam room, expecting to perhaps feel foolish as I fumbled to answer his questions about the science of his disease. So I simply asked, "How can I help?" And tears rolled down his face. Although he had calmed his mind with his efforts to provide information, he admitted he was exhausted by the years of effort. Henry had taken a good strategy and turned it into an obsession. His mind was quieter by working on feeding it information, but he didn't experience peace. He was still in turmoil, and he had avoided doing any emotional or spiritual work. Over the next couple of years, we had lengthy discussions about his focus on the mind to the exclusion of all else. And very gradually, he started to share his feelings of fear, hopelessness, sadness about losing his hard-earned muscle tone from exercising, and then even anger that therapies weren't being developed quickly enough to help him. I often felt so weary by the end of each visit, but I knew he was doing important internal work. One day, he shyly presented me with a freshly baked loaf of bread. I assumed he purchased it and was shocked to realize that he had made it. "Henry, you've been holding out on me." When I asked him what he was thinking about when he was kneading the dough, he surprised both himself and me when he admitted, "Nothing at all." We had finally stumbled on something that would give Henry relief from his busy mind and would enable him to be better balanced day to day. So at a later visit, he appeared with a vase that he had made for me, and I discovered that he had a new hobby of turning wood. Wow, now our discussion shifted into a new gear as we were mulling over the artistic side that Henry had discovered and how satisfying it was to produce something with his hands. As more years passed, and after many more discussions, Henry gradually did address the emotional and spiritual issues as he freed up some of the energy that he had used to focus on the mind. So I believe that the work that he did very much altered the quality of his journey and eventually gave him the peace of mind to live more fully despite his cancer. I have a large number of patients whose cancers are in remission. When I walk in and ask, "How are you?" I hear all too often, "I'm here." Oh, my goodness! Where's the joy, the expression of gratitude for being back in good health? Where's the excitement about living? It's all become buried under life's stresses. At diagnosis, we're stopped in our tracks. Life's responsibilities are lifted, and everyone rallies around to support us in getting well. After the initial shock dissipates, and it always does, there will be time to think about life. So if return to full health happens, would you return to what you were doing? I remember reading a quote from Maria Shriver, who was referring to the year 2011 as a year in which she was trying to reimagine her life. And she said, "You have to let go of the life you planned in order to make the life you're meant to live." That clipping is still on my refrigerator door. I met Jackie when she was diagnosed with a highly curable small breast cancer. And although she was in remission, she appeared to be stressed at most visits. She had her brow knit together in a frown, and I assumed that it was related to coping with a daughter with special needs who would likely need lifelong care. At one of the visits, I asked her more about this tension that was emanating from her, and she told me that she had a very successful career as a financial advisor, but that it was draining her. I asked her what she wanted to do instead, and she wistfully replied, "I want to be an artist. But of course, that's not practical. My husband's a pastor and doesn't make much money." I told Jackie that listening to the longings of her heart would probably enrich her life and possibly even increase her chances of staying clear of cancer by doing something she was passionate about. When she returned to the office 6 months later, she was smiling and her eyes were sparkling. She had quit her job after that prior visit to pursue art full-time. She and her husband discussed it and believed that they could live more simply on his current income. And surprisingly, not long after she made the career change, her husband was offered a new position as a pastor of a much larger congregation and happily was making more money. Jackie's face was luminous as she described her studio, her fiber art, and the shows where her work was being exhibited. She was relaxed and fulfilled in her life and didn't really have time to worry about cancer recurring. What if advanced cancer is present and there are no curative therapies? In those situations, focusing on healing is paramount because curing isn't yet possible. Simply put, healing is the attainment of inner peace. It's a process that unfolds over time, a continuous journey toward hope and peace of mind. It's not so easy to accomplish, but it's something that can be worked on every moment, right up to the last breath. Healing is available even if the body is losing the battle to cancer. Emotions and spirit can actually thrive while confined to bed as life is waning. Inner peace can absolutely be achieved even as death cannot be fended off. But it's a personal choice to try to accomplish that. Patty was 37 years old and was terminally ill with metastatic breast cancer. She wanted desperately to see her 7-year-old daughter have the sacrament of First Holy Communion in the Catholic Church. As Patty grew weaker, we were concerned that she wasn't going to survive to the following week. So I called the hospital chaplain and arranged for the sacrament to take place at the bedside. Her daughter came in wearing her white dress and veil, surrounded by relatives and friends. The priest was there to administer the sacrament. And Patty was so thrilled to see her greatest wish fulfilled. She was assured that her daughter's spiritual life was on track. And when she passed away just a few days later, truly at peace, it was wonderful. Her family was so happy. So there's lots of blessings that come after the diagnosis with cancer, and some of them can even be in the terminal stages. I can't go into them all, but I've got one story that I must share. And this is about a patient who's well. Her name is Laura, and she's 72 years old and had just finished therapy for metastatic breast cancer. And she said, it was a gift. It allowed me time to sit in the chair and escape from the madness of living. She told me about a lot of the gifts that she had received, and one was something called a paper hug. A paper hug, I had no idea. The children in her youth group wanted her to know that she was loved. So they took their hands, traced it on paper, cut it out, wrote their name on it, and strung it together with pink ribbon. Some of them were crudely cut because they were little kids, and some were more precise from the older kids. She was really touched by this gesture. So after her treatment, she, her husband, and a bunch of their friends were going on a cruise to Hawaii to celebrate their 50th anniversary. At the last minute, she tucked the paper hug into the suitcase, and when she got on board ship, she put it around her neck and wore it around. Fellow passengers stopped her every day and asked her, "What is that?" And she shared her journey with cancer. She was also there to renew their vows in the hospital's chapel. And when they walked in that day, the place was decorated with white roses. Her friends were smiling. The officers had their dress whites on. And there was Laura, elegantly attired in gold, wearing the paper hug around her neck. After the ceremony, they went up on deck to take some photos. And suddenly, the wind kicked up, and the paper hug lifted up and wafted up into the blue sky. Gone. She never got her photo that she could give to the kids back at home. And she was desolate, so her friend wrapped her in a real hug and said, "You don't need it anymore, you're well." She couldn't believe that such a simple gesture from paper and ribbon would touch her soul in such a profound way. So I'm going to change topics here to talk about some of the more difficult conversations that are part of my work. What do you say when everybody is clear that someone's time is running out? Well, if you're the person that this is happening to, it's hard to see any opportunity in that because many people would prefer to just die suddenly with no illness. But with some coaching, that time can be used well. For instance, I ask people to think about what's been left unsaid and find the courage to say it. Who needs to be forgiven? What needs to be brought to completion before you leave this earth? And one of the most important things you can do is take out old photos and look at them, review your life, and celebrate the person you are. My own father, Andrew, had both bladder and prostate cancer at age 72. He was the oldest of 5 children, and there was no cancer in the family, but Dad rallied quickly and completed his therapy. In his early 80s, he had a major stroke, so I rushed home to New Jersey and spent some time with him, and he said to me with slurred speech, "I always thought I would die of cancer." He was bewildered that the stroke had happened, and I was impatient. "Why on earth would you think that, Dad? Your parents died of strokes, not from cancer." So he recovered fully from the stroke, had a second stroke, more serious, recovered from that, and got to his 90th birthday. So we took Dad out for a celebration dinner, and as he settled back in his chair, rubbing his tummy, he said, "This damn heartburn is going to kill me." Oh my gosh, startled, I joked back, "So this is the Last Supper, right? What a way to go." And we all laughed, but I felt very uneasy. I had this sinking feeling he was pointing to a cancer. A few weeks later, he was indeed diagnosed with esophageal cancer that had spread to his liver. Being his favorite physician, he called me to discuss treatment. "When do we go to surgery?" he said. "Too late, Dad." Undaunted, he said, "Okay, radiation and chemo, sign me up." On the other end of the phone, I shifted uneasily, but proud as heck of his fighting spirit and warmed by the knowledge that I had his genes. When he realized we couldn't treat at his age, there was a long silence. And then just like that, he said, okay. Wow, he was fine. It's interesting that he always knew he would die from cancer. It made me wonder if those thoughts he had over the years contributed to how things turn out. Did that ensure he got past the strokes to die of cancer? Does saying something often enough to yourself become a self-fulfilling prophecy? In the months that followed, we all struggled to adjust to the notion that Dad had an untreatable cancer. And every day at work, I looked at the adult children of my own patients and wondered if they were faring as badly as I was. I wanted to scream at the universe. He'd already paid his dues. Why did he have to have a third cancer? Couldn't he have died from a stroke suddenly? So while we were all in turmoil, Dad seemed to be just fine. In fact, he was cheerful after years of complaining that he felt lousy. Everyone he knew had already died, and now he seemed relieved to know why he felt poorly. So what did we do? Well, after 30 years of living separately but never divorcing, my mom reconciled with my dad. She said, "I forgive you if you forgive me." Now, we weren't privy to the inner workings of their marriage, but we all knew that my brother Andrew's drowning at age 7 was at least a part of the difficulty between them. So I called my dad and I said, "Hey, Dad, I heard that you and Mom are talking." "Oh, no," he said, "we're not talking. We're smooching." With time running out, they were able to forgive each other. I put a lot of thought into what I needed from Dad before he passed, and the answer kind of startled me. What I wanted most was a long hug with my ear against his heart, like he had held me when I was a baby. I wanted things to come back full circle, to end the way they had started, with the comfort of my dad's arms wrapped tightly around me. So I did carve time out of my busy schedule to go home and have the hug, and it was probably one of the most deeply satisfying of all the many moments that I spent with him. My brother needed something different. He needed to know that Dad had accepted Jesus as his Savior, and my dad had. My sister came to understand that she was special to Dad being his namesake. Over the months that we gathered at his bedside, we told stories, we laughed, we cried, we looked back at old black and white photos and forced the real truth out of Dad. He was even here to enjoy a new great-grandbaby. We had 3 months with Dad, and it was so well spent. My sister Andrea said, "I can see why you do this work. I didn't know that dying could be a celebration of living." And that's what we did as a family. It was a priceless gift to celebrate Dad's life with him before he passed. We wouldn't have had that opportunity if he had died suddenly of a stroke. And each of us experienced a great healing. And when it was his time to go, we were able to let go. His dying was enfolded in the embrace of our living. He passed without any pain, surrounded by music and unconditional love. And we all became peaceful in the face of his serenity. So a few words to those of you who have had cancer. It's a curious thing that at the very moment we perceive that life can be snatched away, all that is precious comes into sharp focus. Life's turmoils recede, the I have to, I ought to, I should, the regrets, all dissolve away and we become acutely aware of the blessings. What rises to the surface of our consciousness is the importance of relationships, with family, with friends, with community, with God, with self. We wonder if we ever really knew why we were here. Was our potential realized? Did we do our best? Did we speak our truth? Did we matter to those around us? Did we experience loving and being loved fully and unconditionally? Did we extend a hand to others with kindness and without judgment? Were we of service to people in our lives, our community, and our world? Did we explore the longings of the heart and give them wings? Did we see and touch the divine in everything? Did we take a moment to savor beauty? Did we care for the natural world around us? Was joy present? Did we express gratitude? Will we be remembered after we pass? 1,000 questions can be present in a single moment. In the end, each of us wonders after being diagnosed with cancer if there's enough time left to set it all right. For many, the diagnosis of cancer is the challenge that startles us to coming fully alive in the moment, to appreciate ourselves, each other, and our beautiful world. The fortunate ones will actually say that they lived their best life after diagnosis. Cancer causes a rude awakening. But you rally, you take action in the face of fear, and tap into a strength previously unknown. When you feel as if you can't take the next difficult step, someone reaches for your hand and you aren't alone. You grieve what's ended, and then, however impossible it seems, you let change propel you into a place entirely new. Many may have looked at you after diagnosis and pictured your demise, perhaps your healthcare team included. But the diagnosis also enlivens you by thrusting you right into the present moment. It takes courage to tackle this enormous challenge. But the point of living is to have experiences, feel feelings, and engage in all of the action around us, leaving our mark on the world. In the words of Eleanor Roosevelt, quote, "You gain strength, courage, and confidence by every experience in which you really stop to look fear in the face. You must do the thing you cannot do," unquote. As long as we're alive and breathing, there's hope. Perhaps after listening to this talk, you can see opportunity in the diagnosis of cancer, and perhaps envision a different experience than what you may have first imagined. You've been looking at this butterfly picture next to me. I'm a photographer. Picture the caterpillar that spins its cocoon and totally dissolves into a liquid matrix, regroups, and then emerges as a butterfly. This symbol of transformation absolutely applies to the cancer experience. This miraculous metamorphosis from a crawling caterpillar to a beautiful winged insect reminds us of the infinite potential we each have to reshape any challenge. We can change darkness into light, ugliness into beauty, lethargy into activity, illness into health, and fear into peace. Each of us has choices about how to move forward after any challenges that come our way. So I'll leave you with the thought that each of you is just a heartbeat away from healing. It's up to you.